Greetings, everyone, and thank you for joining the Technical Assistance webinar for the National Lupus Outreach and Clinical Trials Education Program Notice of Funding Opportunity. My name is Sinceri Cobb-Souza, and I'm the Director of the Division of Program Operations within the Office of Minority Health at the U.S. Department of Health and Human Services. I am joined today by my colleagues, Ms. Tish Hall, Project Officer in the Office of Minority Health, and Dr. Scott Moore, Director of the Grants and Acquisitions Division and the Chief Grants Management Officer in the Office of the Assistant Secretary for Health for the department. Our presentation slides today, along with a list of frequently asked questions or FAQs, will be posted to the grants.gov webpage. To access the frequently asked questions document, you will need to go to the Notice of Funding Opportunity or the NOFO webpage on the grants.gov website. To get there, you can search in the grants.gov search browser for the phrase National Lupus Outreach and Clinical Trial Education Program or NOFO number MP-CPI-23-003. The first result will take you to the NOFO's webpage. You will navigate to the Related Documents tab for the slides, the Frequently Asked Questions document, and other resource materials. Please note, we have reviewed all questions that were sent prior to today's call. Many of your questions will be answered throughout the presentation. You may enter your questions in the chat box during today's webinar. Also, to ensure fairness, questions received via email and in today's chat will be grouped by category and answered in the Frequently Asked Questions document of the grants.gov website. At this time, I will turn it over to my colleague, Ms. Tish Hall.
Thank you, Sinceri. Excuse me. And can we go to the next slide, please? Today's technical assistance webinar will provide you with an overview of the Notice of Funding Opportunity, the competitive application requirements, and a question and answer session. Next slide, please. Please be informed that the NOFO is available to provide you with the essential information and guidance regarding application. It is highly recommended that you read the entire funding announcement and follow the NOFO carefully. Please note that the information provided in the NOFO takes precedence over any conflicting details in other documents. Next slide, please. The National Lupus Outreach and Clinical Trial Education Program is intended for projects to demonstrate the effectiveness of interventions for increasing racial and ethnic minority enrollment and retention in lupus-related clinical trials. This initiative is to increase the minority participation in lupus clinical trials while addressing lupus-related racial and ethnic health disparities. Recipients will be expected to demonstrate and sustain increased enrollment of racial and ethnic minorities in lupus-related clinical trials through outreach, education, and interventions, as well as public and private community partnerships. OMH expects recipients to identify and sustain effective interventions that advance clinical trial diversity and ultimately result in reduced lupus-related health disparities experienced by racial and ethnic minority populations. Next slide. The Lupus program has been supported by OMH since 2009, and it has addressed lupus health disparities. The Lupus program has helped to improve lupus awareness, diagnosis, and treatment through increased collaboration among lupus organizations dedicated to research, education, support, and advocacy. We've helped to improve outreach and education efforts in the community and engagement of healthcare providers, educators, and health profession schools. Under this initiative, OMH will continue to support the development of public and private partnerships with organizations representing lupus patients, implementation of effective interventions, engagement of the lupus community to increase participation in clinical trials for minority populations at highest risk. Next slide, please. We expect recipients to utilize standard practices necessary for establishing and effective collaboration partnerships. So we ask that you include public and private and community partnerships that will assist in developing a structure for regularly engaging the community and partner organizations in the design and review of outreach or education interventions to be tested through your project. Recipients should leverage the strengths of each partner, and partners may also play a role in sustaining the project after the award ends. And in supporting or sustaining effective practices to increase racial and ethnic minority enrollment and retention in lupus clinical trials. We strongly encourage recipients to engage community-based organizations in their project implementation as appropriate. Recipients should implement a project that involves at least 2 collaborative partners with at least 2 different organizations. One of those organizations must be a local hospital, healthcare system, federally qualified health center, or community health center, national, state, or local professional organization that represents primary care physicians, other healthcare providers, and/or community health workers. An organization with experience recruiting minority participants into clinical trials, or a tribe or tribal organization. Next slide, please. Another expectation is the adaptation of existing interventions. We encourage recipients to adapt an existing OMH funded intervention, which can be found in section 1.5 in your NOFO, to increase minority participation in clinical trials for intended population of focus, while maintaining the fidelity of the original intervention. When we speak of fidelity, we refer to the degree which an implementer adheres to the core components of the intervention. We also expect recipients to implement the adapted intervention and ensure that the sustainability of the improved results are met. Recipients should implement the adapted intervention or interventions in racial and ethnic minority communities within cities and/or counties where lupus clinical trials are recruiting patients. For current lupus clinical trials, see section 6.16, section 1.6 in your NOFO. The interventions that you will be able to review will include education models that improve attitudes and practices of healthcare providers and paraprofessionals, outreach and social media campaigns on lupus clinical trials aimed towards racial and ethnic minority individuals, as well as capacity building models designed to recruit, enroll, and retain participants in clinical trials and patient-centered, culturally appropriate clinical trial education models. Next slide, please. We also ask that projects demonstrate increased enrollment in lupus clinical trials. We expect recipients to demonstrate the extent to which the project has increased the number of participants recruited, screened, and enrolled into lupus clinical trials. This would include diverse racial and ethnic populations in lupus clinical trials, and to ensure the treatment and approaches and outcomes reflect the reality of the disease among various groups, thereby promoting health equity and facilitating a better understanding of the disease. Next slide, please. The implementation of a process and outcomes evaluation is expected. We expect projects to implement a rigorous evaluation to assess the impact of project activities. In addition to this measure, recipients should measure lupus clinical trial knowledge of healthcare providers and community health workers and measurable attitudes, knowledge and beliefs gained during pre and post-test surveys. The evaluation should also assess the continued effectiveness of adaptive interventions, the fidelity, and any differential effects based on the adaptation approach. Recipients should implement a process and outcomes evaluation that assesses the extent to which the intervention increases racial, ethnic minority referrals, enrollment, and/or retention in lupus clinical trials. The evaluation design should control for threats for validity, including effective size, and we expect the impact analysis of the intervention to be conducted within the period of performance. Next slide, please. We also expect recipients to communicate and disseminate project knowledge and findings to include dissemination to federal, state, territorial, and tribal public health agencies, policymakers, community organizations, community members, and other stakeholders. All appropriate findings and products must be posted on HHS.gov sponsored website, which can be found in section F.9 in your NOFO. We expect the nationwide dissemination of products and knowledge will occur. And when published, materials should be freely and immediately and equitably accessible to the public. Recipients should document project knowledge and findings to include implementation processes, lessons learned, successes, and challenges. Next slide, please. The development of a disparities impact statement is a part of this initiative. Recipients must create a DIS that uses local data to identify the populations most at risk for health disparities. This should be done during the project period. Next slide, please. So now we will transition into the application content. Next slide, please. The content of the application includes project narrative, budget narrative, and appendices. Let's focus on the project narrative content next. Next slide. We recommend that your project narrative include the following components: significance of the project, goals, objectives, and outcomes, project plan, organizational capacity, evaluation plan, and dissemination. The project narrative content can be found on pages 13 through 17 in your NOFO. Next slide, please. We will walk through each section. Significance of the project. We ask that you describe how the project will benefit the field, targeted population, and society. We ask that you describe how you envision the project will benefit the field, target population, and society as a whole. Describe in this section the quantitative data, the significance of your project in meeting the need of increasing enrollment in clinical participation trials within your intended population and geographic areas of focus to address the disproportionate impact of lupus on racial and ethnic minority populations. Please refer to the population of focus data provided in your appendices, section D3C3, as appropriate. Your description should identify the contributing factors to the disproportionate impact addressed in your project. We ask that you describe the barriers to your focus population's participation in clinical trials, how the project will potentially affect that population served, specific subgroups within those populations, and other identified interested stakeholders. Also describe the anticipated importance supported by data for public-private partnerships and community partnerships to support and sustain project activities. Next slide, please. So next, the goal and objectives and outcomes. Related to this project plan, we expect you to outline specific, measurable, achievable, realistic, time-bound, inclusive, and equitable goals and objectives for your project. The acronym is SMARTY. We ask you to connect them to your project approach and your work plan. Identify measurable outcomes that demonstrate the impact of your intervention on participants. We ask you to envision how your project will benefit the field of health, the health system analysis, health policy research, health disparities, and evidence-based policies and interventions for underserved populations. We ask you to clearly identify the measurable outcomes that will result from the project and provide specific quantified estimates of expected outcomes. Next slide, please. The project plan should provide a detailed summary of activities to be undertaken and how those activities will assist in achieving the project goals and objectives, including increasing minority participation in lupus clinical trials. We ask that you explain the rationale of the lupus intervention selected. And again, we strongly encourage you reviewing those previously OMH funded interventions. We ask that you identify any evidence gaps and needs of the proposed activities, describe how the intervention will be tailored for the population of focus while maintaining fidelity to those core components. We ask that you describe how the approach will increase the number of participants recruited, screened, and enrolled into clinical trials. And last, we ask you to describe how the proposed intervention is culturally and linguistically appropriate for the population of focus. Next slide, please. Organizational capacity. Please describe how your organization or your division of a larger agency responsible for this project is organized, the nature and the scope of its work, and the capabilities that it possesses. Describe any current or previous relevant experience, including any significant experience relative to the inclusion of minority populations in clinical trials. Describe any experience and expertise in providing outreach to and education of minority populations through clinical trial outreach to increase enrollment, evaluation of outreach, education, and training programs related to recruitment, participation, and retention in clinical trials, as well as working with individuals and families of people living with lupus. Next slide, please. Also, under organizational capacity, we ask that at a minimum, key personnel includes the project director, principal investigator, who will have day-to-day oversight of the project. You should identify the specific knowledge and expertise on issues related to clinical trials to support developing and implementing effective outreach or education interventions regarding lupus clinical trials. You should also identify the significant knowledge and expertise in lupus epidemiology, diagnosis, treatment, and disparity-related issues. Key personnel includes those individuals and roles who oversee the technical, professional, managerial, and essential support functions and/or assume responsibility for assuring the validity and quality of your organization's project. Last but not least, we ask that you describe areas of expertise through, describe your organizational skills, experience, capability, and capacity for forming, managing, engaging, and partnering with organizations in the implementation of health projects. And one important thing that I did skip is describing your existing public and private community partnerships relevant to this project and identify those partner roles and responsibilities in reference to any submitted memorandums of agreement or memorandums of understanding. Next slide, please. The evaluation plan, you will need to provide a plan of evaluating your project's success and assessing the impact of your activities. This includes the logic model, baseline data, measurable targets, and tools for measuring outcomes and lessons learned. Please outline methods of measuring change and monitoring project outcomes. Any other identified individuals or organizations responsible for evaluation, and ensure that the evaluator has independence of the project. Next slide, please. And the dissemination plan. In this section, we ask that you review and provide documentation for how you will share your project's results with the public and interested parties. Describe the method that you will use for dissemination of the project's results and findings on time and in easily understandable formats to the target population served, the general public, and other parties interested in using project results. Consider how your results, including baseline, target, time frame, and outcome data for the population served. And dissemination efforts should focus on assisting those who may want to replicate your project in the future. Next slide, please. The application review information, which can be found on pages 32 through 35. So let's transition into the application review information. Next slide. A lot of this information you have heard previously, but I want to walk you through the point values that are assigned to each of the areas that we ask for in the program content. Significance of the project. Again, this is where you demonstrate a well-supported case for quantitative data that will benefit the field, targeted population, society, and by addressing the contributing factors to the barriers to increasing participation in lupus clinical trials. Also, the degree to which you provide a rationale for the level of public-private partnerships and community partnerships to support and sustain project activities for lasting impact. This section is worth 10 points. Next slide. The goals, objectives, and outcomes is worth 15 points. In this section, you will demonstrate a strong, clear alignment of goals, objectives, and measurable outcomes for implementing an innovative model for lupus clinical trials. That's a typo, and that will be updated in the slide deck before it is uploaded. Also, you will describe objectives that are specific, measurable, achievable, realistic, time-bound, inclusive, and equitable. So remember the acronym SMARTY. And you should quantify and include baseline data and quantifiable timeframes for achievement. You should clearly support the expected measurable outcomes that result from the proposed project for implementing any innovative model, including public, private, and community partnerships. Next slide, please. The project plan, worth 25 points. Applicants should describe the approach and rationale for recruiting, enrolling, and retaining intervention participants. Should be a well-defined and well-developed plan to likely increase the number of participants recruited, screened, and enrolled into lupus clinical trials. In this section, you should also anticipate barriers to the minority population in the lupus clinical trials and accounts for them. We ask that you describe your approach for developing public and private community partnerships and related activities and how they would support the success of the project. And demonstrate the use of data collected over the course of the project to support quality improvement, ensure that the project is implemented in a culturally appropriate manner over the full period of performance. Next slide. We will evaluate applicants based on their capacity, experience, and expertise to complete project activities within the given time frame. This section, organizational capacity, will be worth 20 points. When demonstrating the capacity of carrying out the activities, we ask that you provide relevant experience, include working on clinical trials with racial and ethnic minority populations, providing outreach and education to racial and ethnic minority populations, clinical trial outreach to increase enrollment and retention, and evaluation of outreach and training programs. Also, the readiness to implement the project and achieve measurable outcomes within the period of performance. Key personnel roles, responsibilities, and capacity to engage partners to support project activities should be included, as well as evaluation activities with necessary qualifications and degree of independence. Next slide, please. The evaluation plan, which is worth 20 points, should describe the feasible, rigorous evaluation approach for effectively demonstrating the impact of the project on the population of focus and on disparities in clinical trial enrollment. You should identify data for collection to be used to ensure that the project activities are achieving their intended objectives. We also will look for the project's logic model, including how the inputs, processes, outputs, and outcomes will be measured, and the rational and well-supported activities. Any involvement of partners in the evaluation activities is appropriate and beneficial to overall evaluation will also be reviewed. Next slide, please. Last, we have the dissemination plan, which is worth 10 points. The applicant should effectively share the impact of the project that is proposed, an adequate method to disseminate the results and the findings of the Lupus program and its impact, including innovative approaches to reach the population that's served, the general public, and other parties who might be interested in using the results of the project. The plan should also include timely dissemination in an easily understandable format to all intended audiences. Next slide, please. So next, we will talk about the budget and application submission and review procedures for the cooperative agreement, not the cooperative agreement, for the grant. And I will hand the presentation over to Scott Moore from the Office of Grants and Acquisition Management.
Thank you, Tish. Good afternoon, everyone. I am Scott Moore. I'm the Director for Grants and Acquisitions Management in the Office of the Assistant Secretary for Health. And more importantly for this process, I am the Chief Grants Management Officer for OASH, providing services to several program offices, including the Office of Minority Health. Just a reminder that everything we say during this webinar, this is an informational technical assistance webinar, but it is the NOFO, the actual document itself that contains the rules and all of the guidelines for the application process. And that is the document that controls, should there be any conflict of information between this presentation and the NOFO, it is the NOFO that is the controlling document, and that is how we will assess compliance with the application process. The most important thing to know that everybody always asks, and we'll repeat it several times more before we're done, applications are due by 6:00 p.m. Eastern Time on August 1st, 2023. That is 6:00 p.m. on the dot, not 6:01. We will disqualify applications that come in after 6:00 p.m. Next slide, please. Now that submission time will be determined by the date and timestamp provided by grants.gov. When you complete the submission of your application, you must submit electronically through grants.gov. You are strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. We say this each and every NOFO that we present a webinar on, and there is always a crush of applications coming in at the very last minute. That is rolling the dice and taking a risk that you will not make it in by 6:00 p.m. that day. We also note that grants.gov is a system that we do not own. We are required to use it. And we cannot control any technical issues that happen on that side. So better to try getting your application in early just in case there are technical issues, so that you have a better chance at getting it in. Technical issues don't arise often, but when they do, we are still pretty firm on the application due date and time. Now, once you do submit into grants.gov, it may take up to 48 hours for grants.gov to notify you of your successful submission. That is another reason to start early. And if you have failed to submit your application by the due date and time, we will not review it. It will receive no further consideration. It does not go to the panel. Next slide, please. Eligibility for this particular opportunity. Any entity that is a public or private nonprofit, sorry, there's a typo on the slide. You must be a nonprofit entity located in a state, which includes one of the 50 states, the District of Columbia, the Commonwealth of Puerto Rico, U.S. Virgin Islands, Commonwealth of Northern Mariana Islands, American Samoa, Guam, Republic of Palau, Federated States of Micronesia, and the Republic of the Marshall Islands. So a state is defined broadly to include the territories. And again, you must be a public or private nonprofit entity located in a state, and therefore you would be eligible to apply under this announcement. This also includes private nonprofit institutions of higher education within the eligible class of applicants. Next slide, please. Faith-based organizations and American Indian, Alaska Native, Native American organizations that are public or private entities that are nonprofits are eligible to apply, and also public or private nonprofit community-based organizations are eligible to apply. This language is correct in the notice of funding opportunity, and this is why we always direct you back to the notice of funding opportunity. Public or nonprofit community-based organizations that are nonprofits are also eligible to apply. Next slide, please. The way these are coded into grants.gov, eligible applicants would be state governments, county governments, city or township governments, special district governments, independent school districts, public and state-controlled institutions of higher education, Native American tribal governments, federally recognized and non-federally recognized, other than federally recognized, public housing authorities, Indian housing authorities, nonprofits having 501c3 status with the IRS, and those without 501c3 status with the IRS. Please note that as part of the final review of applications, you may be asked to provide documentation of your nonprofit status to support your eligibility. Next slide, please. You are not required to provide cost sharing or matching in your proposal budgets. However, if you do so, you will be held to that amount if an award issues. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification, or your application will be disqualified. During the merit review of an application, cost sharing will only be considered to the extent that it contributes to the overall adequacy of the total proposed budget, that is the federal and the non-federal share total, in support of the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. You will be held to that amount, and any change in that commitment will require prior approval of the grants management officer. Next slide, please. The NOFO provides information and guidance related to the applications and the process. We recommend you read the entire funding announcement, and really we recommend that you read it a couple of times. Follow the NOFO carefully. Do not try to prepare your application using these slides. The information provided on the NOFO takes precedence over any conflicting information in any other documents. Next slide, please. To obtain the application package, or the application kit, as we sometimes refer to it, you may obtain this electronically through grants.gov. We couldn't have made the address any simpler. Grants.gov will take you there. Find it by searching the assistance listing number. We used to call them the CFDA number. So you may see that legacy name on there somewhere. And that's found on page 1 of the NOFO. But right here, we've given you the assistance listing number, and that is 93.137. Be sure to subscribe to the announcement in grants.gov so that you receive notification of any updates to the NOFO or supporting documentation. And over time, there have been instances where we have had to update to correct typos in NOFOs. So you do want to be sure that you see those notices and those updates as they occur. Next slide, please. OS requires that all applications be submitted electronically via grants.gov. You can obtain an exemption to this. It has to be approved by the grants management officer, which will either be Dwayne Barlow or I. And it needs to be approved in writing according to the criteria laid out in section D5. If you submit an application via any other electronic communication, it will not be accepted for review. Please do not email us your applications. If it does not come in through grants.gov, it is not considered submitted. Grants.gov is a website portal. It is not a portal that we own in OASH. All funding opportunities and grant application packages are made available on grants.gov for not only OASH, the Office of Minority Health, but for the vast bulk of the federal government. An application will not be considered valid until all application components are entered and received in grants.gov and received by OASH Grants and Acquisitions Management. We refer to ourselves as GAM. According to the deadline specified in the dates section of the NOFO, that is again, 6:00 p.m., August 1st, 2023. Please contact grants.gov directly with any questions or concerns regarding the electronic application process. Their help desk is amazing. They can solve all kinds of technical problems with the interface and the technical pieces of uploading your application. When you do talk to them, please get a ticket number for the issue and have that available for us if we need to ask you for it, to intervene or review any issues as they come up. But again, to resolve the issue, don't waste time coming to us, go directly to the grants.gov helpline. Next slide, please. Now, your application must be submitted as 3 files. Your entire project narrative is 1 file. And that is described in section, all of these are described in section D8A in the NOFO. Your second file is going to be your entire budget narrative, including all supporting documentation described in the budget narrative content section of the NOFO. Your final file is going to be a composite of all of the attachments that are described in the attachments section for your grants.gov application. This is typically things like the CVs or the resumes, your work plan, those things that are described as appendices for your application. When it comes to the required standard forms, They will not count toward your page count limitations in the submission requirements, which we will go over. And those are found in section C4 of the NOFO. Next slide, please. Any files that you are uploading, those 3 files in particular, or anything that you're attaching to a grants.gov application must be in one of the following file formats: Microsoft Word, PowerPoint, Adobe PDF, or an image format, which is limited to only 4 types of formats: JPEG, GIF, TIFF, or bitmap. Those are the only file formats that the grants.gov and our review system will recognize. Do not submit Microsoft Excel files. They will not be accepted. Now, we strongly recommend, we have a lot of experience dealing with this, we strongly recommend that when submitting your electronic application, you do so as an Adobe PDF. Convert it yourself to a PDF prior to submission. Almost all word processing software and tools these days have an export to PDF or a print to PDF option. We highly recommend that you do that so that you may see how the pagination and the formatting may or may not change. In this case, you may prevent any unintentional formatting that might occur with submission of an editable document. And in fact, if you submit a document such as Microsoft Word through grants.gov, when it is transmitted to us, it is converted to a PDF, at which point, if there is any change in the file, it is the file, the PDF that we receive and send to the panel that counts. So we want to make sure, and we want you to make sure that you do not lose any of the formatting that may be valuable to the assessment of your application. Also, printing to a PDF, if nothing else, lets you check the page count for your PDF because we are sticklers for the page limits. And this way you can ensure that your document does not exceed the maximum page limit. Next slide, please. In preparing your application, please be complete. Do not leave blanks on any forms unless the information is clearly not applicable to you. We recently received an application in one of our competitions and the form was blank. That disqualified the application. You need to fill in the forms. It's not enough just to submit a form. It needs to have the information in it. Please also note that the individual submitting the application forms, they need to have the legal authority to act on behalf of your organization. At least once in my career, it's been a surprise to an organization that an application was submitted to the grant-making agency because the person who submitted the forms did not have the legal authority to do so. So please make sure that you have the legal authority to act on behalf of your organization. Next slide, please. To ensure a successful submission of your application, carefully follow the step-by-step instructions provided at grants.gov. The link is presented here. It is very easy on the grants.gov site to navigate to this, but basically you're looking for apply for grants. These instructions are kept very much up to date and also provide links to frequently asked questions and other troubleshooting information. We unfortunately do not have the bandwidth to assist each and every individual potential applicant with how to navigate grants.gov. We do highly recommend the resources on the grants.gov site to answer any questions. Next slide, please. So the application elements, as I mentioned, there are a series of forms. This cycle, we have actually been able to eliminate one of our forms. So we've cut it back just a little bit. But there are a few forms that are required. There's the application for federal assistance, the SF-424, the budget information for non-construction programs, SF-424A, disclosure of lobbying activities, SF-LLL, and the project abstract summary. Now, these forms will all be located on grants.gov once, and with the NOFO active. And you'll be able to download the package, the application package that will have all of these forms in it. That constitutes the forms part of our submission. And again, the 3 files that we require that we highly recommend being in a PDF format are going to be your project narrative, your budget narrative, and your appendices for your application. Next slide, please. Now, one of the forms that you need to complete is the project abstract summary. We've started highlighting this. You must complete the project abstract summary form provided in the application package. It is a must complete. The abstract will be used to provide reviewers with an overview of the application and will also form the basis for the application summary in the grants management and program summary documents. Why this is important is because if you are funded or your project is funded, we publish this abstract straight off the form onto tags.hhs.gov and to usaspending.gov as part of our compliance for transparency in what is being funded. And again, that is only for those projects that are funded. We do not publish them for unfunded projects. Now, also note that the abstract may also appear on the program office website or other government websites, so do not include sensitive or proprietary information in your abstract. Next slide, please. All right, some of the mechanics of formatting your application, particularly your narrative documents. The project narrative format instructions are located in the NOFO. Your application will be disqualified if it does not conform to the format requirements. It must be double spaced. You must use 12-point font, and it must be a font that is readable, such as Times New Roman or Arial. You should see a trend in some of these. We want your application to be readable. We want your ideas to come across to be reviewed. We want to make it easier for our reviewers. Now, you may single space tables or use alternate fonts, but again, we need to make sure that things are readable. For appendices and your budget narrative, you should use the same formatting specified for the project narrative with one caveat. You may use standard common forms for such documents as resumes, CVs, biographical sketches, work plans, items like that. So again, the benchmark is going to be, it needs to be readable. Next slide, please. Now, to submit an application in grants.gov, you must have a UEI number, a unique entity identifier. We have simplified this process a little bit over the last couple of years. You no longer need to go to Dun and Bradstreet to get a DUNS number. The UEI is now part of your registration in SAM, which is the System for Award Management, managed by the General Services Administration for us. Your UEI is going to be a 12-digit number as opposed to the old DUNS, which was a 9-digit number. And most of the UEIs are primarily letters and not numbers. So you'll be able to, it's an easy way to recognize it. You should begin your registration process, including receiving your UEI SAM and your SAM registration overall at sam.gov. We've provided links throughout the NOFO to the new entity registration checklists. It is essential and required that you have an active SAM registration to submit your application. There have been some delays in SAM registrations of late. So if you have even the slightest thought that you are going to be applying for this opportunity, please either apply for a new SAM registration if you have never had one, or you may renew your SAM registration. Please make sure that that is up to date. I cannot make an award to anyone who does not have an active SAM registration. Next slide, please. Now, the actual timeline or time commitment for the actual registration online is about 30 minutes. It's not particularly onerous. It can take, though, after the registration, we expect up to 10 days, but it may take longer depending on volume. We do know that the SAM registration volume has been extremely high this year, so count on it being more than 10 days. The average time for updates in SAM.gov to appear in grants.gov is 72 hours. So again, if the application is due on August 1st, don't cut it close and start your SAM registration 2 weeks before. It's going to be too late. There's nothing we can do to help you. Right. Next slide, please. Now, SAM registration must be renewed each year. We do monitor this. We get a red flag when it expires, and we can reach in and halt, either suspend projects or hold back continuation funding. So once you get registered, make sure you keep it up to date. For those of you who have registered before, now is a good time to check and see when your expiration date is. SAM recently, and we'll probably delete this next year because it's been a couple years, but if you're renewing your registration and you had an old sam.gov username and password, it probably isn't going to work for you anymore. They've completely transitioned to login.gov. Again, another means of simplifying things, one login for folks for all of the government websites. Next slide, please. Again, just reminders, we strongly recommend that you check for an active registration well before the application deadline. If you are successful in receiving an award, you must keep that registration active at all times. If when it comes time for us to make the awards, if your registration is not active, we may determine you are not qualified and you will not receive an award, and we can move on to another applicant and make an award if they've got the active SAM registration. So please, please start your SAM registrations now, and please keep them active. Now, should you successfully compete and receive an award, please note that all your first-tier subaward recipients must also have a UEI number at the time you, the recipient, make a subaward. So your sub-recipients are going to need to be registered in SAM before you can make your award to them. Next slide, please. We do have a few funding restrictions that we need to think about as you're preparing your budget. Please note that if you are successful in receiving an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of the award. Other departmental regulations and policies in effect at the time of the award and applicable statutory provisions. Currently, HHS operates under 45 CFR Part 75, not 2 CFR Part 200, except for some provisions, and that is outlined in the Notice of Funding Opportunity, and we keep that up to date. HHS keeps that up to date on the websites. For costs to be included in the budget and to result in fund drawdowns, the costs must be allowable, allocable, reasonable, and necessary direct expenses or associated indirect costs in accordance with regulations and current policy. Indirect costs are allowable as described in 45 CFR 75-414. You have two options or two methods upon which you may claim indirect costs, and these are described in section D3B10. It jumps out in the text at you, I promise. You must choose between one of those two, and if you are waiving or reducing your negotiated indirect cost rate, you must include an explicit statement that says so and describe it in your justification for that. Pre-award costs are not allowed. So no costs that happen before the project start date as noted on the notice of award when awards are made. There is a current salary limitation effective January 2023. This is based on the federal executive level 2 salary. This is a statutory requirement. And this is, while we present the annual rate here of $212,100, it should be prorated. So if you have an executive who is allocating only 50% of their time, you can only claim and charge to the award 50% of this amount. So, and this is described in much more detail in the notice of funding opportunity. Next slide, please. Continuing on about the budget really consists of 3 components for us. The SF424A, which is the budget form, the budget narrative, which is often combined with the detailed budget justification. These must be consistent with the requirements of the NOFO. Your budget should support the project that you are proposing to do and not anything else. Budgeted costs must reflect the proposed activities. Budget line item descriptions or cost categories or object classes, whatever you refer to them as, and justification requirements are explained in much more detail in the NOFO. We have suggested table formats in the NOFO as well. And note that you also need to provide a plan for oversight of federal award funds. And this is described further in section F3B2. One thing to note when it comes to page limits, the forms, the budget narrative, and the detailed justification do not count toward your overall page limits. We need to see the detail. We don't restrict the page limit. Next slide, please. When developing your itemized budget, which you must do, you're going to use section B, box 6 of standard form F424A. And this is to report the first year, just 12 months of the proposed project. Now, when we have projects that are anticipated to be less than 1 year in total duration, this would reflect the entire project. In this particular case, we're looking at a potentially multi-year project. Only show us the first year of the proposed project on SF424A in box 6. Box 6 really is, it takes up an entire page. And you're going to provide a budget justification, which includes explanatory text and line item detail for the entire first year of the proposed budget. That's really the one where we need to see the detail. Your budget narrative should describe how categorical costs, such as salary, equipment, supplies, consulting costs are derived. Discuss the necessity, the reasonableness, and allocation of the proposed costs. Next slide, please. For the subsequent budget years in a multi-year project, provide a summary narrative and line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, provide a detailed justification explaining why there's a difference. Right, so just a reminder, when you are filling out box 6 of SF424A or box 18, it asks for the total funding request. Box 18 of SF424, these amounts are for the first budget period, only the first 12 months. Next slide, please. As I mentioned, when it comes to indirect costs, there are 2 methods you can choose from. These again are described in 45 CFR 75-414. It's also described at length in the notice of funding opportunity in D3B. You may select from one of 2 methods. You may only select one and must clearly identify that selection in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or any other cognizant federal agency, you should select that rate and provide a copy of your current approved rate agreement in your budget narrative file. If you're an applicant that has never had a negotiated indirect cost rate, you may elect to charge the de minimis rate of 10% of the modified total direct costs, which may be used indefinitely. If you choose this method, It must be used consistently for all federal awards, not just this particular one, until such time as you choose to negotiate for a rate. Next slide, please. If your proposed budget requests a rate that is less than allowed with your negotiated cost rate, your authorized representative must submit a signed acknowledgement that the organization is accepting a lower rate than allowed. We are looking for an explicit statement of, yes, we know our negotiated rate is X, but we're going to accept Y, and here is why. To obtain a negotiated indirect cost rate, for those of you who may not have one but want to get one, you may contact the U.S. Department of Health and Human Services Cost Allocation Services regional office that's applicable to your state. And the contact information is available at rates.psc.gov. PSC is the Program Support Center here within HHS. Next slide, please. All right, so we've talked a lot about what you need to do to get your application in the door and what your application should look like. What will get your application disqualified? If you do not submit electronically via grants.gov by the due date and time, you will be disqualified unless you have an exemption that was granted at least 2 business days prior to the deadline, and that would be an exemption in writing from either of the grants management officers at least 2 business days prior to the deadline. Now, should you happen to submit multiple applications for the same project, and we are quite rigid on it being the same project, we will only review the last application received by the deadline. Sometimes what will happen is folks will upload one draft, decide or change their mind, want to update the draft. It actually comes through as multiple applications for us. So we will only take the last one received before 6 p.m. on August 1st, 2023. Now it's my staff in GAM that deems your application eligible or ineligible. And you must complete all required forms in the application package, the SF424, the 424A, the LLL, and the project abstract summary. Note your application must be submitted in the English language and must be in terms of US dollars. This is by regulation 45 CFR 75-111A. Next slide, please. If your application does not meet the following requirements, it will also be disqualified and receive no further consideration. Your project narrative must be double spaced. It must be on the equivalent of 8.5 by 11 page paper size with 1-inch margins on all sides and a font size of not less than 12 points. The project narrative must not exceed 30 pages. The total application, which is the project narrative plus your appendices, your attachments, must not exceed 50 pages. So if your project narrative is 30 pages, you may have 20 pages for your appendices. If your project narrative is only 25 pages, you may have 25 pages for your appendices. Next slide, please. All right, a couple of more disqualification criteria. Your request for federal funds, including indirect costs, cannot exceed the maximum indicated award ceiling per budget period, which is 1.25 million. Your total request must not be below the minimum indicated as the award floor, 975,000. As I mentioned before, if you have included voluntary cost sharing or matching in your proposal budget, you must include in your budget narrative a non-federal sources justification, or you will be disqualified. Your application must meet any application responsiveness criteria that is found under section C3, titled Other Application Responsiveness Criteria. Next slide, please. And for you guys, you were lucky. There are no other application responsiveness criteria found in C3. So that last bullet, there's nothing there to disqualify you guys on. Next slide, please. So applications that are lacking in the required supporting documentation, for instance, CVs, or a work plan, or that submit additional appendix files that go over the page limit. You may not be disqualified from the competitive review. However, the application goes forward without those CVs or without that work plan. And how the panel scores that is probably not going to be in your favor. On occasion, appendix files, it's part of an appendix would go forward, but not the complete appendix would go forward. So be sure to follow submission instructions very, very carefully, and we don't have to get into the disqualification of applications. It is one of those things that we don't like to do. Next slide, please. Once your application makes it through the eligibility screening and goes through gets reviewed for under the disqualification criteria, once your application clears those steps, it will go to our review panel, and the review criteria that they will use to assess your proposal are listed in the NOFO. It'd be the significance of the project, 10 points, goals, objectives, and outcomes, 15 points, your project plan, 25, organizational capacity, 20, evaluation plan, 20 points, and your dissemination plan, 10 points. Next slide, please. Now, the folks that are going to be applying those criteria to your proposal are going to be a panel of independent reviewers with technical expertise in the applicable fields according to the criteria listed in the NOFO. The merit review process in OASH, as in most other grant-making offices, is formal and confidential. Federal staff are going to be available to our panelists to answer questions and to ensure that the process is consistent and fair, but the federal staff will not participate in the discussion and assessment of the application during the panel review. It is only after panel review and the panel recommendations come forward that the applications are then reviewed by my team for administrative and business compliance and by the OMH program office staff for programmatic compliance. Next slide, please. Once these levels of review are completed, it will be the Deputy Assistant Secretary for Minority Health who will make final award selections that will be recommended to my team, and the Grants Management Officer, to conduct a risk analysis. And it is only after the risk analysis is completed and with concurrence of the Grants Management Officer that awards can be made. Now, as part of the Deputy Assistant Secretary for Minority Health's assessment and recommendation making process, she is able to take into consideration the following additional factors: equitable geographic distribution of projects. Next slide, please. Again, once we complete the risk analysis and with our concurrence, we will then issue the notices of award for those who are recommended for funding. No award decision is final until the notice of award. You'll hear us sometimes call it the NOAA. The notice of award is issued. All award decisions at that point are final, including the level of funding. And if an award is made, the decision is final and it is not appealable administratively. Next slide, please. Please note that we are not obligated to make any federal award as a result of this announcement. Only the Grants Management Officer can bind the federal government to the expenditure of funds. If you receive any communications to negotiate an award or request additional clarifying information during the review process, this does not mean you will receive an award. It only means that your application is still under consideration. And again, all award decisions, including the level of funding, if an award is made, are final and you may not appeal. Now, if you do receive those communications to negotiate or request additional information, I will say those requests will come from my staff on the grants management team. They will not come from the program office. Next slide, please. Now, when we do our review of risk, we evaluate each application according to the criteria provided for us in the regulation at 75-205. We use a risk-based approach, and we may consider any items such as the following, and we can consider more. This is not an all-inclusive list, but we will look at your financial stability, quality of management systems, and ability to meet the management standards. History of performance. Have you had federal awards before? Were you timely with your compliance and your reporting requirements and conformance to the terms and conditions of those awards? We will look at reports and findings from audits and look at your ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities or recipients. Next slide, please. When you are preparing your plan for oversight of federal funds, federal award funds that is submitted as part of your budget, just note that if your internal controls are available online, you can just provide a link to those as part of your plan in your budget narrative. This actually speeds up the risk assessment process for us. We don't have to come asking for it. It's already a link. We can go look for it. We have also included supplementary material in the NOFO, particularly section I-2, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. So if we determine that we are not going to be able to fund your application, and that is because of a risk determination that prevents us from doing so, note that we must report that determination to the integrity system known as FAPUS. And generally, for those of you who have experience applying for federal awards, FAPUS is the database that we consult to determine your past performance with other federal awards. And in particular, if there is a negative report in FAPUS and we use that negative report as a means for us to determine that it is too risky for us to make an award to you, we do have to put that information into FAPUS. Rarely ever comes up for us. But we do need you to be aware that, if we decide not to make an award and you have a FAPUS entry and we're doing it based on that FAPUS entry, we also have to report that and you have the ability to review that. Next slide, please. So it is the notice of award, or the NOAA, that notifies the successful applicant of their selection, the award amount, the project, and budget periods. It includes any conditions on the award, and that means any requirements that must be met as a condition of receiving the grant funds. It also includes all of our standard terms, reporting requirements, and contact information for the relevant federal contacts, in particular the grants management specialist and the project officer in the program office. Next slide, please. Now, my office is the official GAM, is the official contact for awardees throughout the entire award life cycle. So from the moment the NOFO is published to the moment that the awards awarded underneath it are closed out. All official communication related to the award is between GAM and the successful applicants. Unsuccessful applicants will be notified by the program office by a letter once the competition is completed. Next slide, please. Just a few summary tips, digesting everything down. A lot of this should be hopefully common sense. When you're preparing your project narrative description, be clear, complete, and concise in the project. About the project, follow and address exactly what is being requested in the NOFO. Just like taking an exam, make sure you answer all the questions and all the parts of the questions. Don't make the reviewer search for the required information. Generally, the easier the application is to review and read, the better the rating or score. No, the reviewers are not allowed to do external research. They cannot follow embedded links. You can't cheat and get more pages by embedding links and expect the reviewers to go there. We do not let them. We will disqualify the entire panel and impanel a new set of reviewers if we need to. Clearly identify the sections of the application and indicate which component is being addressed. Headings are your friend. The project narrative must include all required information within the page limit. Do not use appendices to artificially expand your page limit. Next slide, please. Make the goals and objectives SMARTY. specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives. The program work plan, evaluation plan, and budget should provide a complete picture of how you will address the needs, as well as address the purpose and expectations in the NOFO. Next slide, please. Staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Be complete in describing what staff will do, the expertise required, and the percentage of their time that they will be assigned to the project. Next slide, please. Budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The project should be reasonable, or the budget should be reasonable and relate directly to the goals and objectives. Do not request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income, which can be fees from third-party payers and other contributing funds. You are likely not going to have program income as part of this announcement or part of your application, but it is there just in case. Next slide, please. Overall, when you're putting names of your essential personnel, the authorized organizational representative, your PDPI, anybody who is going to be essential to the project, please include a first, middle, and last name. We have folks sometimes who will submit and only include their initials, and it really slows down the award process when we're doing our exclusion checks. And we have a lot of back and forth, and in some cases, people just don't want to give us their names, and we have to ask for a social security number, and that is just really not what we want to have to do. Electronic submission is required. Do not wait until the last minute to begin your SAM registration or update your current registration. Do not wait until the last minute to begin the electronic submission of your application. Problems could arise. Next slide, please. Or any inquiries, questions, or concerns about how to prepare your application, we have several contacts for you. For programmatic questions, Paul Rodriguez in the Office of Minority Health is your point of contact. For anything else, administrative or financial questions, process questions, anything that's not directly related to the project itself, the programmatic piece of the project, please contact Dwayne Barlow. He's a grants management specialist and one of the GMOs in my office. Really, we recommend if you've got a question and you're not sure, most questions are going to cross between program and grants management. Save yourself the time, get a faster answer. Email one and CC the other. It is summer, folks take vacations. This will be the quickest way to get a response. You can also email the OASH_grants@HHS resource box as well. But going directly to these two gentlemen will get you an answer pretty quickly. Now, if you have any questions or concerns about or technical issues with the electronic aspects of submitting your application, again, that's going to be grants.gov. Cut out the middleman, go directly to them. You can call them, you can email them, you can go right on their website. Please don't contact OASH program or grants office staff for any grants.gov issues. There's not much that we can do other than refer you to these points of contact. And with that, I think I'm ready to turn it back over to Sinceri for questions.
Great. Thanks so much, Scott. At this time, we will begin our question and answers session. Please continue to enter your questions in the chat box. If we are unable to answer your questions during our webinar today, we will incorporate your question and a response in the frequently asked questions document or the FAQ document that will be uploaded to the grants.gov NOFO page. So at this time, we're going to begin our first question specific to eligibility. And this question is either for Scott or for Tish. What applicants are eligible for this NOFO or this announcement, and how are they determined for the purposes of this NOFO?
Great Great question. Tish, I'll take this one since we had the typo and it was in my section on the slides. So once again, and this is correct in the NOFO, applicants are eligible if you are a public or private nonprofit entity located in a state. State includes the 50 states, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, Republic of Palau, Federated States of Micronesia, and the Republic of the Marshall Islands. To clarify even further, private nonprofit institutions of higher education are eligible to apply. Faith-based organizations and American Indian, Alaska Native, Native American organizations that are public or nonprofit entities are eligible to apply. Public or nonprofit community-based organizations, also known as CBOs, are eligible to apply. The key is that you must be nonprofit. Examples include state governments, county governments, city or township governments, special district governments, independent school districts, public and state controlled institutions of higher education, Native American tribal governments, public housing authorities, Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, and nonprofits having or not having 501c3 status with the IRS.
Great. And just for further clarification, Scott, can you tell us if an individual or a for-profit organization or agency can apply for funding?
So that's a two-part question. For-profits are not eligible and will be screened out in the initial eligibility screening. Individual applicants are not eligible. This opportunity is only open to entities, so which are either public or nonprofit entities in this case.
Okay. Final question there. Third question relates to eligibility, and that is specifically, Scott, can you tell us who will decide or make the funding decisions?
The funding decision, it is really a two-part process. The program office, the head of the program office, which in this case is the Deputy Assistant Secretary of Minority Health, will make recommendations based on the panel reviews and input from the technical reviews and the business reviews that we do. We'll make recommendations for the slate of awards to be made. That slate is delivered to my team, specifically to me as the grants management officer, to conduct a risk assessment. And it is only those that survive the risk assessment or make it through the risk assessment that can then be funded. So.
Great. Next question. If you would remind us of the deadline for submission of the competitive application.
Applications are due August 1st, 2023. It's 6:00 p.m., not 6:01, 6:00 p.m. on the dot, as indicated by the timestamp from grants.gov when the application is submitted.
Yeah, and the next one is probably clear, but I think it's important that we state it. When you said 6 p.m., what time zone?
6 p.m. Eastern.
Thank you. All right. Following up on questions and preparing to apply. Next question is for Tish. How can I stay up to date on any updates or changes for the NOFO? Tish?
I'm here trying to unmute, sorry. So yes, all information will be updates, and any updates to the information that we've shared here today, as well as the NOFO, if there are any edits or revisions made, will be able to be located through grants.gov. And there you will just search for the Lupus Clinical Trials project or program, and you will be able to see any additional updates in that criteria.
And Tish, to follow up, is it possible for interested persons to subscribe from the grants.gov page for the announcement to receive updates?
Absolutely. We strongly suggest that you subscribe to the grants.gov website so that you can get those most up-to-date alerts for any revisions or updates that are provided.
And next question, follow-up, Tish. I have questions regarding the NOFO or developing my application, who should we contact?
So programmatic questions, such as developing elements of your application, you should contact Paul Rodriguez at paul.rodriguez@hhs.gov. And any questions related to financial and grants related questions should go to Dwayne Barlow. And that's Dwayne.Barlow. Yep, you can see it right here on the screen. At HHS.gov, and that's for financial and grants related questions. Also, please CC Paul Rodriguez on any emails that you may send to Dwayne, as well as CC Dwayne for any information that you send or questions you send to Paul.
Next question is for Scott, and it's preparing the application. If you would, Scott, if you would clarify the maximum number of pages and the application. So if you could review that for us, we appreciate it.
Sure, and thank you to the person who asked the question in the chat. We did pull up the NOFO just now. So there is another typo in the slides, and we do apologize for that. This is our second of these today, so sometimes things get a little muddled. Your project narrative must not exceed 60 pages, and your total application project narrative plus the appendices must not exceed 80 pages. So I think before we had said 30 and 50. So you got a little bit more room to describe your projects. 60 for the project narrative and 80 total pages project narrative plus your appendices.
Thanks for that clarification. Scott, next question. What registrations are needed to apply for this announcement?
So you must register with SAM.gov to apply for this announcement. That is the registration that must be active to submit your application. As part of registering for SAM.gov, you will be issued something called the UEI, the Unique Entity Identifier. So it should be a fairly simple, straightforward one-step process now, at least one site to go to for this registration. It was a long time coming that we were able to get rid of the two-site registration process. So saves you a little bit of time, but I don't want to give you a false sense of more time. Go ahead and get those registrations done now.
Thanks. Next question is for Tish under preparing to apply. Tish, if you would, tell us if applicants are required to submit the memorandums of agreement or MOAs and letters of commitment or LOCs. So the question again, Tish, are applicants required to submit MOAs and LOCs?
Yes, so applicants are to refer to pages 24 and 26 in the NOFO. And if available at the time of submission, sign MOAs or sign LOCs, which are letters of commitment, may be submitted for each partner. Or one signed memorandum of agreement with all partners, which includes their specific roles, responsibilities, resources, and contributions as the partner to the project. If the applicant is unable to submit a signed MOA, the applicant must submit an unsigned MOA. Fully executed MOAs and finalized tribal resolutions will be required following the issuance of any award made before the announcement, if not received prior to the award. If you are not providing these documents with your application, please indicate the anticipated date that will be the fully executed documents will be available for submission.
Okay, so the next question is specific to program expectations and to follow up to one of the program expectations, Tish, that you covered with your presentation this afternoon. This is specifically related to the disparity impact statement. Tish, are applicants required to submit the disparity impact statement or the DIS with their competitive application? This question is for Tish or Scott.
So it's,
Go ahead, Scott.
I'll jump in. So it's, you are not to submit your disparity impact statement as part of your application. It is something that will be done only by those who receive awards after the award period has started.
Great. And so then our final question is on the program side. If you will, Tish, can you tell us what type of interventions, based on what's published in the NOFO, what type of interventions should be considered for possible projects to tailor and implement for the purposes of this NOFO?
Again, for the purpose of this NOFO, we encourage using previously funded OMH, Lupus clinical trials projects that were previously funded for OMH or through the OMH project. We do recognize that there are numerous interventions, and we are asking you to take a look at those interventions that are already have been tested and proven through OMH funding, but also to look at those interventions related to the target population, and you are allowed to make adaptations to those projects as a part of the existing program that may have been previously funded.
Okay, and so Tish, for a prospective applicant, can you tell me if the interventions, if they consider this is in line with the language in the NOFO, interventions that can include provider education models to improve attitudes and practices of healthcare providers and paraprofessionals, outreach and social media campaigns on lupus clinical trials aimed at the service population, capacity building models for CHWs to increase minority enrollment and retention in lupus clinical trials, and lupus clinical trial education models for minority populations. Would that be consistent with the OMH program expectations for this competitive NOFO?
Absolutely. That is exactly what we're looking for when submitting your program or project plan and selecting your interventions.
Great. So at this time, I want to thank our presenters today, Ms. Tish Hall and Dr. Scott Moore. Please note, we will upload the frequently asked questions document to include the questions that were entered in the chat today with the responses, along with the recorded technical assistance webinar link that will be uploaded to the grants.gov NOFO webpage. Thank you all for joining us for the Office of Minority Health's Technical Assistance webinar, and best of luck on your competitive application submissions. Good day.